coming up, I am now 9 months on testosterone, so might as well. Alright, so of course you're going to need your testosterone, which should have a warning to say keep away from the light. And if your doctor knows what's good, he prescribed you 2 different needles or syringes. A larger needle, this one is an 18 gauge, used for getting testosterone out of the thing because it is indeed a thick liquid and is very slow. And then the needle that comes on the syringe should be smaller, so you're not stabbing yourself with a thick bamboo stick. I mean, not that this is made of bamboo, but just as an example, okay? Okay. So, this is a ice pack on my leg. It's a very useful ice pack. I'm not sure where it came from, but it kind of collapses. It's got Velcro, so it's easy to have it there while I prepare my needle without having to hold it. Alright, so I'm going to move this out of the way. And, my voice is actually a lot deeper than this. It's, I just talk very fast a lot, and like I said in every video, changes for comedic effect. So, we got this needle, we're going to unscrew this. There we go. Now, we're going to put this on. The first time I did this, it was very difficult for me to unscrew it, because I was afraid I was going to break it. But when you start to realize how it's done, you don't get so freaked out. So, there's that. So you're going to need 2 alcohol pet pads. One is for the vial itself, and the other is for your leg. So this is a new vial. I was actually originally on a vial that had enough doses for like a year, but that is not very healthy or sanitary for you. So that's weird. Doesn't appear to be a lot of fluid in here, but I guess that is it. So my bigger vial still has some left in it, but I gotta flick that off. One swipe across it is good. Or you could then use the other side. Alright. Don't really trust it. So what we're going to do is now that we got the needle uncapped, you got to be very careful with this. You want to draw it back to your dosage. I am actually on twice my dosage, but I supposed to be doing it once a month, and I don't want those uneven levels at the end of the month. So I divided it myself into 2 different doses. So I'm going to put this straight through. I'm going to push that in. And then we're going to draw it back. Now it is a thick substance, so you're probably going to want to tilt it to bring it in, which is absolutely fine. Just make sure you can see how much you're digging in, and make sure you get the right amount. Air bubbles start to form. You can try and flick them. If you're worried about getting the right amount, grab a little bit more. It's not going to kill you. Okay. Now that we got it filled with fluid, we're going to recap this. I'm going to unscrew it. I'm going to put this other needle back on. And now what you gotta do, you gotta uncap this, and you gotta push until some of the fluid comes out the tip, and there we go. Looks like I did it perfect. And we're gonna recap that until I'm ready to use that. So make sure the cap is on, and make sure if you're putting the cap on that you do not push this. Now, it may seem like something stupid, like why would you ever push that? But once I was having trouble putting that cap on, and that thing went in, and gotta get another shot. So, I'm gonna unwrap this now. My leg is nice and numb. I was able to walk around with this thing on. I'm gonna open up my other alcohol pet pad. I'm gonna put this back in the box so it doesn't get messed up. my other alcohol prep pad. So the muscle you should aim for is your leg muscle on the outside. If you do the top, it's going to hurt like hell. You do the side, it's going to hurt like hell. You do over here, it's going to sting a little bit. But the reason you do this muscle is because whenever you're standing or even slightly sitting, this muscle is in use. It is the strongest and will take the easiest. Your doctor probably told you to stab it. Excuse me, you do not have to stab it. You do not have to stab it. As long as you're going against this muscle, it goes this way, you'll be fine. So I'm going to try and put it right here. The higher up, the better. The lower you put it, it's going to hurt. Or so I've found. Can't really prove that with evidence. Do that in a circle, and now we're going to uncap this. And I'm going to put it right against the skin. Oh, fuck that bone. You have to grip your leg muscle, and I really hate doing my right leg because even though I'm ambidextrous, it's very difficult to grip. So I'm going to recap this right now for a second so I can take care of this. Disgusting. Without touching it. No. Go away. The one patient's still going off. Ugh. Alright, so you want to grab this muscle while you shut the. I hate that flipping house phone, I'm telling you. Nobody ever answers it. I'm gonna get another prep pad. When you have to grip your leg, put a needle in, and draw for blood, you find yourself in difficult times. I almost forgot to grab it. Alright. Uncap that. I'm gonna grab that. I'm gonna put it right against the skin, and you're just gonna push. Just keep applying pressure. It will eventually go in. And when you get it in, you want to draw back to draw for blood. If there's no blood, you're good. There's no blood. So now I'm just going to push it in. Got to push it a little bit slow. It takes a minute for it to move away from the site. This is actually one of my better injections, and I am surprised, frankly. Alright, so all of it got in, and I'm going to... Oh. Whew, I thought that was blood. It was just the needle because it looked kind of red. Oh, I got freaked out. You know you will have a good injection when you pull it out and there is little to no blood at the site. And my lighting is terrible, but that is a freckle. That is not the site. The site was right here. And let's see. There, I'm not even seeing my site. Oh, there it is, right there. Little to no blood at a good injection. I didn't have to stab it. There was minimal pain, and there's little to no blood. So, Jesus, what I'm going to do now is, don't really see a need to wipe it with the alcohol prep pad, and that blood up, and then you put a band-aid on it. Sometimes you're going to get more blood, sometimes you're going to get less blood, sometimes you're going to wish that you would never attempted to give yourself that shot. But in the end, if you're afraid of pain or blood or needles, you have to look at it as you're not doing something to hurt yourself. You're doing something to further yourself, to help yourself, to get you somewhere where you need to go. And after you're done with it and you see those changes start to happen, you're going to be glad that you did. And you will get used to it. So, that's it, I guess.